Bonjour et bienvenue à cette conférence de presse.
Good morning and welcome to this press conference.
Je vais maintenant passer la parole
I will now turn the floor over to the Minister of Health, the Honourable Patty Hajdu, who will begin.
to the Honourable Patty Hajdu to begin.
Thank you and good morning. Happy Indigenous Peoples Day. I'm here on the traditional territory. Sorry, there's a lot of feedback here. Can tech support adjust the feedback? Okay, I'll try again. That's better. Good morning and happy Indigenous Peoples Day. I'm here on the traditional territory of the Robinson Superior Treaty Area, homeland of the Fort William First Nation, and contributed to by many generations of Métis people. Recently, we shared with Canadians that thanks to their efforts, we can now begin to adjust measures at the border. Beginning on July 5th, fully vaccinated travelers who are permitted to enter Canada will no longer be subject to the federal requirement to quarantine. Fully vaccinated travelers will not be required to take a COVID-19 test on day 8 or stay at a government-authorized hotel. Je peux confirmer que dès le 5
I can confirm that as of July 5th, fully vaccinated travelers who are authorized to enter Canada will no longer be obligated to quarantine. These vaccinated travelers will no longer have to quarantine in a government-authorized hotel or complete a test.
vaccinated travelers, you will still need to meet a series of requirements, including pre and on-arrival testing. We are continuing these testing requirements to allow public health experts to continue to monitor positivity rates at the border and monitor for variants of concern. Having this information will allow public health experts to recommend further adjustments to border measures quickly if needed. For travelers who are not fully vaccinated, I want to remind you that there are no changes to Canada's current border measures, and you must continue to adhere to the current testing and federal quarantine requirements. And whether you're fully vaccinated or not, if you're coming into Canada, it is crucial to plan in advance to ensure you're meeting all travel requirements. Your planning should also consider the specific requirements of the province and territory that is your destination. Please continue to check and follow both the federal and any provincial or territorial restrictions and requirements before traveling. As Canadians continue to get vaccinated, we'll be carefully monitoring data here and around the world. We will be assessing our own rates of vaccination, cases, hospitalizations, and outbreaks, and the disease activity in the rest of the world. We'll watch these metrics carefully as we plan the next phase of changes to border measures. Work continues on a proof of vaccination for Canadians that will be certified by the Canadian government. And this work includes ongoing discussions with provinces and territories who have started issuing their own documents. If you are planning to travel internationally this summer, remember to check the requirements of the country that you're visiting. And remember that many countries have had to make sudden changes as they cope with rising cases or severe outbreaks. As we've told Canadians all along, easing measures at the border will happen as we see our communities increasingly become safe. We all want to get back to normal, and everyone can play a part in that effort. If you haven't been vaccinated yet, make a plan today. Help someone in your life get vaccinated. Follow up for your second dose and continue to follow the public health measures in your region. Thank you also to all of the immunizers across the country for working so hard to help us stay safe and stop the spread. We can see our lives return to normal thanks to the hard work of Canadians. Thank you. Merci.
And I will now turn the floor to the Minister of Public Safety and Emergency Preparedness, the Honourable Bill Blair. Je vais maintenant passer la parole au ministre de la Sécurité publique.
I will now turn the floor over to the Minister of Public Safety, the Honourable Minister Bill Blair.
Much and good morning, everyone. I'm very pleased to be speaking to you this morning from my home, which is located on the traditional territory of the Mississaugas of the Credit. And I'd also like to acknowledge today is National Indigenous Peoples Day. Since the very beginning, the government has implemented strong measures to secure our borders and to keep Canadians safe. These measures have proven to be effective, but of course they were never intended to be permanent, and as Minister Hajdu has indicated, phase one of the approach that we are taking to ease border measures will begin on July 5th with reduced public health measures for fully vaccinated travelers with the right of entry and foreign nationals who are currently eligible to enter Canada. It is the traveler's responsibility to plan ahead, to understand their obligations, and to ensure that they are eligible. They should do this before heading to the border by visiting travel.gc.ca. Fully vaccinated travelers who are eligible for the reduced measures must meet the pre- and on-arrival test requirements. They must be asymptomatic upon arrival, and they must provide contract and travel information, proof of vaccination electronically through the ArriveCAN app before arriving in Canada. Our ArriveCAN app has proven to be a very effective application for travelers providing their travel and personal information. Over 2 million Canadians have now used the application for arrival at our border. It is absolutely essential for all travelers to have their ArriveCAN receipt and documents ready, including proof of vaccination before they arrive at the border. And once there, travelers must provide the required information and documents to the border service officers and answer all eligibility, vaccination, and health screening questions. And they must follow the instructions that will be provided to them to complete their on-arrival test and proceed to their destination. Fully vaccinated travelers will no longer have to quarantine or complete the 8-day test. But to benefit from these reduced public health obligations, fully vaccinated travelers must submit their vaccination information using the ArriveCAN app before arriving at the Canadian border. There are no changes to our current border measures for those who are not fully vaccinated, and travel restrictions for foreign nationals, including U.S. citizens, remain in place until at least July 21st. In other words, foreign nationals coming to Canada for non-essential purposes will be turned away at our borders. We recognize that people are anxiously awaiting to reopen the border. And as Canada reaches high levels of vaccination coverage and the COVID-19 severity trends continue to decline, the risks associated with international travel will decrease. A phased approach will allow us to ease border measures in step with the decreasing risk, and it will take into account vaccination thresholds and modeling forecasts, as well as public health criteria. The results of data collected in the first phase, such as the test results of vaccinated travelers, will also help us to determine the timing of future border measures. Discussions are ongoing with provincial, territory, and international partners, with the aim of allowing for the non-essential travel of fully vaccinated foreign nationals into Canada in the coming months. Our top priority continues to be the health and safety of all Canadians. And as the scientific evidence changes and the situation evolves, we will continue to consider additional border adjustments. Thank you very much, and I'm happy to turn the mic over to my colleague and friend, Minister Omer Alghabra.
Thank you very much, Bill. Hello, everyone. Bonjour à tous. I'm speaking to you today from the traditional territory of the Mississaugas of the Credit First Nation. As today is National Indigenous Peoples Day, we celebrate the contributions of Indigenous peoples, and we recommit ourselves to the important journey of reconciliation. Today, we are taking significant steps toward a safe and science-based return to travel. We are able to take these steps because Canadians from coast to coast to coast have rolled up their sleeves to get vaccinated. Vaccination is the key to ending the pandemic. La vaccination est la clé pour.
Vaccination is the key to the end of the pandemic.
To complement the measures announced today by my colleagues, we will be eliminating pre-departure temperature screening for international travelers coming to Canada. This is so that air carriers can focus on ensuring travelers enter the necessary health and vaccination screening information prior to departure and avoid duplication of work. This will make the travel process more streamlined, ensuring that passengers spend less time in airports. Also, to ensure the smooth movement of both vaccinated and unvaccinated travelers through our airports, we will be working with industry to establish separate lines for these two categories of traveler. This means on arrival, we can quickly sort passengers based on vaccination status and get them to the appropriate screening checkpoints efficiently and safely. This means shorter lines, shorter wait times, and getting out of the airport faster. Today, we will also be renewing the flight ban between Canada and India for 30 days to July 21st of 2021. On prolonge l'introduction.
We are renewing the flight ban between Canada and India.
This means that direct commercial and private passenger flights from India will continue to be denied permission to arrive in Canada. Passengers who depart from India bound for Canada via an indirect route must still obtain a valid COVID-19 test result from a third country before boarding a flight to Canada. Today, I'm also announcing that based on the public health data, we will not be renewing the flight ban between Canada and Pakistan. Elnora?
We will not be renewing the flight ban between Canada and Pakistan.
Air travelers from Pakistan will be required to obtain a COVID-19 molecular test in Pakistan to board a flight to Canada. As the situation evolves, we will respond with new and adjusted border measures as needed to keep Canadians safe and the economy running. I will be working with colleagues at the federal, provincial, territorial, and industry level to determine next steps later this summer. This could include expanding the number of Canadian airports that are eligible to receive international flights. And I hope to have more to share with you soon. Merci, thank you. And now I hand it over to my friend and colleague, Minister Marco Mendicino.
Bonjour, good morning. I'm pleased to be joining my colleagues and all of you from this traditional territory of the Mississaugas of the Credit for this important announcement on National Indigenous Peoples Day. We've come a long way over the past year. In addition to the extraordinary sacrifices and progress made by Canadians, we've also seen newcomers step up throughout the pandemic. From putting food on our tables to providing care for our seniors and families, immigrants have continued to deliver essential support, keep our supply chains going, and help to accelerate our economic recovery. Indeed, immigration has been a lifeline. And thanks to the measures we've put in place and the progress all Canadians have made in getting vaccinated, we're now able to take the next staged approach in welcoming newcomers as part of our 2021 Immigration Levels Plan. Today, I'm pleased to announce that anyone with a valid confirmation of permanent residence, in particular those approved after March 18, 2020, will now be eligible to travel to Canada. Je suis heureux d'annoncer.
I'm pleased to announce that everyone with a valid confirmation of permanent residency can now enter Canada and begin the next chapter of their lives. What's even more important is that this permanent resident with an approved permanent residency certificate since March 18, 2020 can now enter Canada.
Valid certification of permanent residency and comply with all other health and public safety screening protocols prior to being admitted. L'annonce aujourd'hui est une étape.
Today's announcement is an important stage in our pandemic approach. We will continue along this path.
An important milestone. It will allow us to continue to welcome hardworking newcomers, reunite families, and show Canada's leadership when it comes to humanitarian resettlement. These permanent residents will help drive our economy forward and strengthen our long-term prosperity. We can cautiously but optimistically cast our eyes to the future, which is bright, and the newcomers who will help build it. Merci, et maintenant je vais passer.
Thank you, and I'd now like to turn the floor to Minister LeBlanc. Thank you very much, Marco. And this is National Indigenous Peoples Day, and I'm very pleased to welcome you. As my colleagues have just said, the government has implemented strong measures to secure our borders and keep Canadians safe. These measures have been effective, but they were never meant to be permanent. As my colleagues indicated, phase one of the approach we're taking to easing border measures will begin on July 5th with reduced public health measures for fully vaccinated travelers with the right of entry and foreign nationals who are currently eligible to enter Canada. It should be noted that it's the traveler's responsibility to plan ahead, understand their obligations, and ensure that they're eligible. It is important that all travelers have their ArriveCAN receipt and documents ready, including proof of vaccination before they arrive at the border. Fully vaccinated travelers will no longer have to quarantine or complete a day 8 test. But to benefit from these reduced public health obligations, fully vaccinated travelers must submit their vaccination information using ArriveCAN before arriving at the Canadian border. They have to meet various requirements. They have to go through a test before they arrive and one upon arrival. The decision to keep these requirements was made so that public health experts can continue to monitor positivity rates at the border, as well as variants of concern. With this information, experts will quickly be able to recommend other changes at the border when required. There are no changes to our current border measures for those who are not fully vaccinated. And travel restrictions for foreign nationals, including U.S. citizens, remain in place until at least July 21st. As Canada reaches high levels of vaccination and coverage and the COVID-19 severity trends continue to decline, the risk associated with international travel will decrease. A phased approach will allow us to ease border measures in step with a decreasing risk. We will take into account vaccination thresholds and modeling forecasts, as well as public health criteria, such as the number of cases and the number of hospitalizations. The data gathered during this first phase, such as the results of screening tests of vaccinated travelers, will help us determine the timing of future border measures. We will be continuing to monitor the number of cases, hospitalization rates, and vaccination rates in Canada, here in Canada, and elsewhere in the world in order to determine any adjustments that need to be made. We will look carefully at the data to prepare for the next phase in order to decide whether we need to update these requirements once again or to remove them. Discussions are underway with provincial, territorial, and international partners are ongoing with the aim of allowing for the non-essential travel of fully vaccinated foreign nationals into Canada in the coming months. Today, we will be renewing the flight ban between Canada and India for 30 days, namely July 21st. That means that flights, both direct and commercial and private, coming from India, bound for Canada, will remain banned. According to the public health data, there will no longer be any flight bans between Canada and Pakistan. Our top priority continues to be the health and safety of all Canadians. And together, we will beat COVID-19. Thank you very much. And we would obviously be pleased to answer any questions you may have.
Take your questions. So Jean-Sébastien, over to you.
Thank you, Minister Leblanc. Merci, Monsieur le Ministre. Donc, nous allons maintenant débuter la période de questions.
We will now begin the question period.
As usual, it will be one question and one follow-up. Comme d'habitude, ça va être une question et un suivi.
One question, one follow-up.
The operator for the first question. Je vais maintenant passer la parole à l'opératrice.
I will now turn the floor to the operator for the first question. Thank you.
Please press star one at this time if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. Our first question is from Glenn McGregor from CTV News. Please go ahead, à vous la parole.
Thank you. Question for Minister Blair and possibly Minister LeBlanc. This is, as far as I know, the first time Canadians will ever be required to show proof of vaccination to obtain any service or exercise any mobility rights. What steps will be taken to verify the authenticity of documents they upload? Will it require sharing data with provinces? And if so, does that not run the risk of violating provincial privacy regulations on health records? And further, how would you verify documents that were issued by another country? If somebody gets a shot in Tennessee or Mississippi, how can you possibly ensure those are authentic by checking with local health authorities?
Well, thanks, Glenn, and I agree. It's an important question, but we will be using in this first phase of easing of border restrictions the Arrive Can app, and the Arrive Can app is capable of receiving documentation from a number of different jurisdictions, not just Canadian jurisdictions, and the application itself can verify the validity of the documentation that's been submitted, but we're also requiring travelers to retain a copy of their vaccination documents, the originals, or a certified translation for verification by the Border Service officers. And they have to also carry it for 14 days after their arrival into Canada. We're confident that we'll be able to identify and verify vaccine certification for fully vaccinated Canadians and those who are exempt from these restrictions utilizing this app. And perhaps others could speak of, there's also ongoing work, working with the provinces, territories, and many of our international partners about other systems of vaccine certification. But we're very confident that the Arrive Can app will do the job for us, for all travelers coming to Canada, to be able to verify the vaccine documentation that must be provided in the digital format, as well as in a paper format to present to our Border Service officers.
Okay, follow-up question for Minister Mendicino, slightly off topic. I think a lot of Canadians were surprised to see NHL Commissioner Gary Bettman show up at the Bell Centre for the game the other night. I'm wondering why the national interest exemption applies to NHL executives and not just players and team officials. And particularly given that there was a positive case amongst a manager, a team official from Las Vegas. Could you explain why that exemption was granted to NHL league executives?
Well, thanks for the question, Glenn, and also good to see you're still following playoff hockey, as I know many other Canadians are as well at this time of year. As I said at the time, we issued the decision after a very, very rigorous consultation with public health officials at every level of government, not only federally, but provincially and municipally. And I want to underscore that prior to exercising the discretion of this office under the National Interest Exemption Protocol, that all officials signed off on the NHL's proposal, which obviously included executives as well. The number that is contemplated by the exemption is manageable, and we know that the NHL has been a very strong partner when it comes to managing the response with regards to COVID. But I also want to take a moment to just really underscore that those protocols under the national interest exemption have not prevented us from keeping other corridors open, including reuniting tens of thousands of families, which we have done both exercising a measure of compassion, but also safely and responsibly in accordance with all of our health protocols which have been in place.
Thank you, Minister. Merci. Operator, next question. Opératrice, prochaine question.
Thank you. Notre prochaine question est de Lina Dib de la Presse canadienne.
La Presse canadienne. Yes, good morning.
For Minister Hajdu, I understand that you're going to be looking at the data after these changes, looking at whatever is going on with the pandemic. But do you have numbers? Like we had this 75 for first dose, 20 for second dose number to begin doing something. Do you have a number in mind for the next step to get to change the rules again? Hello?
Patty, you're on mute.
Merci beaucoup pour la question.
Thank you for the question.
Nous regardons très.
We are paying close attention to the issues we need to monitor.
The metrics that are. Sorry, I'm hearing the translation in my ear here. We're watching very closely the metrics in domestically in terms of what kinds of numbers of people are getting sick with COVID cases across the country, including hospitalizations and rates of vaccination. And of course, as we know, provinces and territories have begun to approach the second doses for many Canadians. And we're seeing great progress, by the way, of second dose vaccination across the country. But we're also watching international metrics. So what is happening in the world with COVID-19? And although we see COVID-19 decreasing in many countries, we also see other countries that are in tremendous struggles with COVID-19. For example, Brazil recently, has, demonstrated numbers that continue to be at extremely elevated levels. And so it is a matter of watching our own epidemiology here in Canada, the capacity of provinces and territories to manage any kinds of outbreaks, as well as what kinds of disease activity we're seeing internationally. And we'll come back to Canadians in the near future on what kinds of metrics will allow us to have the confidence to reduce measures even further.
Okay. Et puis ma prochaine question, ce serait pour vous, Monsieur.
My next question would be for you, Minister LeBlanc. You've been discussing matters with the province for easing of foreign tourists. Where have you got with these discussions, or can we expect an announcement soon, or do you have some type of figure in mind regarding vaccinations before you make such a decision? Thank you. Thank you, Lena. As a government, we do acknowledge the desire from the provinces, the tourist industry, to have further easing of the border. However, as Patty Hajdu and others have clearly said, we believe that it's important. We've made so many efforts collectively to protect Canadians during the pandemic. We have seen other premiers insist on more restrictive measures at the border. So it's a matter of having access to the best scientific data available. And at the same time, we do recognize very well the desire of Canadians and others to get back to normal. What we're announcing today is a first step. It's the first phase. It's an important milestone, and we will continue working with scientists, with provinces and territories over the coming weeks to decide on the timing of other changes. Obviously, if the situation enables it, and here I refer to what Minister Hajdu has said. She talked about the concerns we had. She talked about the concerns we have with other countries, and we are discussing matters with our American partners and other partners in Europe. So we will be back with other changes at the right time. We hope that they will be changes to ease other measures. But for the time being, this is a first phase. It's a responsible one based on scientific data, but we're not insensitive to the desire of various sectors of the economy and Canadians to see other measures take place at the right time.
Merci, Monsieur le Ministre. Thank you. Operator, next question. Opératrice, prochaine question.
Merci. Our next question is from David Akin from Global News. Please go ahead. À vous la parole.
Thank you very much. I'm not sure who wants to take this question, maybe Minister Hajdu, I suppose. So whenever the opposition has criticized any sort of these restrictions, everybody on the front bench has been quick to say and boast that your government makes recommendations based on evidence, based on science. There is no evidence and no science, according to your expert panel, to continue to operate quarantine hotels. So please, could somebody who is into evidence-based governing please explain what does Dr. Naylor not know that you guys at the cabinet table apparently do know when it comes to the science to support quarantine hotels?
Well, maybe I can start, David, and first of all, thank the testing and screening panel for what I would consider a very good roadmap for the next steps on alleviation of measures at the border. Of course, the committee worked on that with prior to the emergence, or at least the widespread emergence of the Delta variant, which has changed considerably some of the projections here in Canada and certainly internationally. And has affected modeling in terms of if the Delta variant is actually able to get a foothold in our communities in a significant way, especially in communities with low vaccination rates. Secondly, all of the advice that we get from a variety of expert panels is then fed through the Public Health Agency of Canada and, of course, Dr. Tam and a variety of different scientists and researchers that advise us. And of course, finally, I'll say this, David, Canadians have sacrificed an extraordinary amount over the last year and a half in ways that we know, in ways that we don't. Small businesses have struggled to stay open. In many cases, some have not managed to stay open. The Canadian government has spent billions of dollars supporting provinces and territories and individuals to get through this extremely difficult time. People have been separated from their families. And this government believes that a prudent, careful and cautious approach to alleviating measures is what's required. We don't want to see all of our hard work put at risk as a result of moving too quickly without truly understanding how the changes we're proposing today will impact Canadians. And so we work with provinces and territories, we work with our colleagues across government to make sure that we make choices that are based on science and evidence and that reflect the ongoing science and evidence, as we know, that evolves with COVID-19.
Okay. So again, an evidence-based government would say, look around and say, okay, vaccination rates are X and hospital capacity is Y and case counts are Z. And having achieved whatever metrics you think you should have achieved, you would have said, right, we can go to phase one of our easing travel restrictions because we'd hit in certain benchmarks, I would assume. And so that's why it's confusing, both on the technical call we just had and in your first response, I think, to Glenn, why you don't have some metrics that you can present to us today for phase two. You had metrics, I would assume, for phase one, which we're getting to today. So having hit those metrics and being able to define them, why can't you define some metrics, give us a sense of case counts, vaccination rates, et cetera, to go to phase two?
Patty, you're on mute.
Thanks again, David, for the question. And again, that's exactly what we're doing. We're monitoring a number of metrics, starting with vaccination of Canadians. And we know that we can see Canadians step up in extraordinary ways to get vaccinated. We're vaccinating even faster than we had originally anticipated. In fact, almost 20%, if not 20% of Canadians have received their second dose. But we also know that with the Delta variant posing some significant challenges to some of our international colleagues, not the least of the UK, who has been gathering a lot of data and providing that to the world. We need to be very cautious. And so the metrics that we are looking at and that we're discussing with provinces and territories are things like case rates, capacity to deal with outbreaks, hospitalizations and ICU admissions, and of course the international behavior of the virus. And we do see a number of international jurisdictions still significantly struggling to save the lives of their citizens. And so we'll proceed with caution. This is what Canadians expect of us. They expect us to not squander those hard-won gains over the last year and a half. Again, I thank Canadians for the sacrifices they're making to keep themselves and their communities safe.
Thank you, Minister Hajdu. Merci. Operator, next question. Opératrice, prochaine question.
Our next question is from Justin Ling from Freelancer. Please go ahead. À vous la parole.
Hey, good morning. Following up on David's question, obviously your target the whole time has been 75% with one dose, 20% with both doses. We're likely to hit that this week and then, slowly surpass it. Why is that target no longer good enough? Especially when you consider, you mentioned the Delta variant a lot. The Delta variant is already responsible for community spread in Canada at roughly the same rate as the U.S. At a certain point, how do you explain this as something other than sort of asking Canadians to be fearful of what comes in from abroad, even though it's already basically here?
Well, thank you very much for the question, Justin. And I'll say again that over the last year and a half, we have watched Canadians across this country sacrifice tremendously to protect themselves and to stop the spread of COVID-19 in their communities. And the measures that we're taking today are a reflection of that hard work, and they're a reflection of the growing vaccination. But we do want to be certain that when we start to see increased numbers of travelers traveling around the world to a variety of different locations and higher volumes of people coming from all kinds of parts of the world, that we have the domestic protection that we need for any importation of COVID-19 that slips through. And we also want to make sure that provinces and territories are fully certain that they have the capacity to deal with any outbreaks that may happen. Well, listen, COVID-19 is here globally and it's here to stay for some time. And so our primary job as the Government of Canada is to work collaboratively with provinces and territories to protect the safety of Canadians. This announcement today is a great step on the way to the alleviation of measures at the border, and it reflects a confidence in the science that is evolving around the effectiveness of full vaccination.
Okay, right, but you're not. You were given recommendations in May that provided a path forward to allowing partially and fully vaccinated travelers come in from the U.S. You're not actually going to implement those recommendations until fully more than a month after they were made. What's more, a big part of the strategy that your government has talked about what a full reopening would look like involves some form of a vaccine passport or vaccine verification. Can you provide an update on where that's at and whether or not Canadians will see that before the end of 2021? Obviously, a big part of the strategy you're talking about, one that relies on vaccinations as a prerequisite for reopening, is going to require, it seems like, that technology. Can you provide an update on when we should expect to see that?
Justin, allow me to at least begin the answer to that question. I agree. We have acknowledged that there are certain benchmarks, certain thresholds of vaccination and case counts, which would allow us to begin appropriately and carefully to ease some of the restrictions we have at our borders. We've reached one of those benchmarks, and today we announced that's going to have an impact. It gives us an opportunity to begin to ease measures for fully vaccinated Canadian travelers, those with a right of entry, and even foreign nationals with the right of an entry to enter the country safely. But I think it's really important to be clear. We've reached an important threshold, but we haven't reached the finish line. There's a lot more work to do. We need to make sure that a substantial majority of Canadians are fully vaccinated. And when we reach that threshold, it's also going to facilitate additional measures, which we're working very hard to be prepared for. Now, with respect to the use of the ArriveCAN app, First of all, it's been in place for several months, and it's been widely adopted by Canadian travelers and those who have been coming to Canada. Over 2 million travelers have actually used the digital ArriveCan app to provide their personal and travel information, as well as their health information, to the Public Health Agency of Canada and the Border Service officers to make a determination on their eligibility to enter the country and to their ability to adhere to the public health measures that have been put in place. And we have been making additional adjustments to that ArriveCan app to allow travelers who are coming to Canada, those who currently would have a right of entry, to use the ArriveCan app to provide that information on their vaccine verification digitally, as well as provide to bring the documents along with them. And in each case, the Border Service officers will verify the validity of that vaccine information prior to allowing entry into the country. The system that we've developed and put in place, well tested through our experience, is going to be able to enable us to facilitate the arrival of travelers, not just the ones exempted under the current measures being announced today, but in the future, for other people who will be allowed entry to use the ArriveCan app for people coming to Canada, both by land and by air. Will be able to provide that information to us, and our Border Service officers will be able to determine, using the application, plus a number of other questions and tests that they will apply, to ensure that those who are arriving in Canada, in fact, are fully vaccinated and therefore eligible for the easing of restrictions that we have put in place.
Thank you, Minister Blair. Merci. Operator, next question. Opératrice, prochaine question.
Thank you. La prochaine question est de Boris Proulx du Devoir.
Boris Proulx, Le Devoir. Floor is yours. Yes, good morning. I'm sorry if you've already answered this question, but how about people who are fully vaccinated? Why is it safe for international tourists such as Americans? And when are we going to see any changes at that level? Perhaps, if I may, I'd like to comment, and if other colleagues want to step in after with comments, they can add to what I'm going to say. As we have said since the start, the border measures are essential to protect the health of Canadians. Canada has made a tremendous amount of sacrifice to try to beat COVID-19 in order to make the hospital rates improve. Since the start of the pandemic, there have been significant sacrifices made, and unfortunately, tragically, people have died or been ill for a great length of time. So all of the measures that we're taking to ease restrictions at the border are being implemented on a gradual basis. We have really based ourselves on the best scientific information available, and we're also aware of the volume of travelers and visitors, as my colleagues have said, who may very well arrive at our border. So what we're announcing today is the start. That's a first phase to enable those individuals who are fully vaccinated and who have the right of entry to Canada so that they can benefit from these eased public health measures. And we will continue talking about this matter with public health measures and provinces and territories at an appropriate time to bring about other measures to ease the border, to enable other people to come into Canada with measures that are adjusted based on public health risk.
Merci.
Thank you. I don't know if anybody else wishes to add to that. I would like to ask you a question about hockey. I heard the minister say that the NHL was a strong partner, a big partner. So I'd like to know the Director General of the Golden Knights was confirmed positive with COVID-19. There was also a member of the Canadiens who was confirmed positive. So when the NHL will no longer be considered a good partner. I'd like to hear your thoughts on the matter. Thank you again thank you for your question. As I already said, we have engaged with our partners, not only at the federal level, but also with public health officials. We've talked to our provincial counterparts. We work closely with the Quebec government to facilitate the continuation of the hockey series. As I already said, the NHL is a very strong partner. And the reason for that is because they have a very understandable protocol to protect the safety and health of all players, all officials, and the general public during the series. That's why we have confidence in the plan. It is transparent. It's been very effective. And every time there is a case within the NHL, the team has measures that will protect everyone. So we will continue. We will be monitoring the situation, and we will be listening to the advice of our officials who work in the sector. Thank you.
Thank you, Minister Menchino. Merci. Operator, next question. Opératrice, prochaine question.
Thank you, merci. Our next question is from Marieke Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good morning. Thanks for taking our questions. Minister Hajdu or somebody else, can you please explain to us and to Canadians who are very curious about this, why these rules require kids who are not vaccinated to self-isolate at home with their parents who can leave the house? Will that not just mean that essentially travel will still be very low this summer?
Well, I can start, Marieke, and thank you for the question. And undoubtedly, this will be challenging for families who want to travel. At this time, the research and science obviously indicates that children can get sick with COVID-19 and they can transmit COVID-19. And because vaccines are not authorized for use in children under 12, unfortunately, most children will not be vaccinated. And so the advice from the team that is of scientists and public health experts is that to protect Canadians from contact with an imported case of COVID-19, that children under 12 do have to quarantine for the full 14 days. Of course, they can still avoid the hotel and their parents as well. They can quarantine at home. And obviously, this is with the lens of ensuring that any unvaccinated traveler that potentially is infected with COVID-19 is taking the appropriate public health measures to protect the community in which they arrive.
Thank you for that answer. I want to go back to this question about the government's failure to release any metrics to justify their rules today or into the future. The business community has been very clear that they need this certainty. They need to be able to plan and to understand when things will change. Why is the federal government unable to release any metrics when every other province and territory has been able to release very clear metrics in order to explain their planning and to explain what to expect next?
Well, again, thank you very much. And first of all, I understand the frustration of people who want certainty around what will happen next. And I think that is one of the most challenging spaces in dealing with a pandemic of this nature, is that, of course, the virus has thrown us a number of curveballs over the last year and a half. And I will just repeat that we are looking at a variety of metrics. And of course, we work closely with provinces and territories as well, who are the first responders, if you will, to outbreaks and a variety of different situations that could arise from growth in cases. We're watching very closely, for example, domestic rates of hospitalization and case growth or decline as it might be.
Why are you not releasing the metrics?
Again, again, we're working very closely, as I said, with provinces, with territories, of course, with the scientists that are advising us through the Public Health Agency of Canada. What we do know is that Canada will be much better protected when we have a much higher rate of full vaccination. So one metric that Canadians can watch for is the rate of fully vaccinated Canadians that is at least 75%. And also how the disease is behaving in Canada. Are we seeing sustained and prolonged outbreaks in regions of the country? How are we managing? How are we managing in terms of our own hospitalization rates and capacity? We've seen, just a few weeks ago, we were sending healthcare professionals around this country to help with burgeoning hospital cases and admissions to ICU that were straining and buckling healthcare systems across the country. We want to make sure that we are not in that situation ever again. And of course, then we're watching the international scene very closely. We know that COVID is mutating, that the Delta variant is the variant of concern that we have our eyes on right now, but that as COVID rages out of control in other countries, that it presents a clear and present danger to all countries. And so on the international front, monitoring very closely what's happening with the virus and as it shifts and adapts to its population. So listen, we'll come back to Canadians. We know there's a desire for next steps, and we'll be very clear and transparent with Canadians. But for now, I would say to Canadians, continue to step up and get immunized, help those around you to get immunized, get ready for your second dose when it's your turn, and we are getting there. We can see the finish line. Let's finish strong, and let's make sure that we protect our gains.
And may I just add something to what Minister Hajdu has said? Transport Canada has a restart working group with the industry where we are in regular contact and discussions with them. So let me again repeat what others have said. We recognize the the desire and the anxiety to have, and understandably, to restart travel. And I know there are a lot of questions. We need to continue to be responsible and prudent, but we also need to engage, and like we have the industry on preparing for phase 2. So we're talking about what the expansion of the number of airports is going to look like. We're talking about testing infrastructure in these airports. So there, and by the way, Budget 2021 has within it up to $100 million to support airports and industry to prepare for that restart. So there are ongoing conversations where we provide ideas to the industry, seek their feedback, receive new ideas from the industry. And that work is ongoing right now, in addition to our discussions with provinces and other stakeholders. Thanks.
And America, if I may also sort of add one other consideration. For the last 16 months, Canada and the United States have imposed together travel restrictions for non-essential travel between our two countries. Those measures that we have put in place have been reciprocal. Basically, if a Canadian traveling into the United States or an American traveling into Canada, the restrictions for non-essential travel have been in place. I would point out that just last night, the United States extended their travel restrictions with the border with Canada and Mexico to July 21st, exactly as we have done. And I hope that Canadians would understand that we will continue to work very collaboratively with our international partners, particularly with our ally, the United States, but we're on both sides of the border. We're proceeding with appropriate caution and care and taking the advice of our public health experts as we begin to ease border measures. But clearly we're not there yet, and we've got a lot of work to do. And I think this is another opportunity just to encourage Canadians to continue to get those vaccinations. When we reach a point where a very substantial majority of Canadians are fully vaccinated, we have the opportunity then to enter into, the potential for additional restrictions, keeping in mind as well, the very legitimate concern that exists with respect to the variants of concern. And that's why our quarantine measures and our testing measures have proven very effective and are still very important to us in protecting the health of Canadians.
Thank you, ministers. Merci. Operator, last question. Opératrice, dernière question.
Merci. Thank you. La dernière question est de Mélanie Marquis de La Presse.
Mélanie Marquis, La Presse. Thank you.
Question is for Minister Hajdu. Why did you choose not to consider people who have been infected by COVID-19 and had only one shot to be considered fully vaccinated? Because as you know, in Quebec, people who have had COVID can only get one dose normally.
Patty, you're on mute.
Merci, Mélanie. Nous avons posé.
Thank you, Melanie. We have asked this question of our scientific community, and we got a quick answer.
Scientists in the scientific community to study this issue and to give us advice as the understanding evolves around the protective nature of vaccination on top of positivity of COVID or having had COVID and recovered. We know that in Quebec, this is considered fully vaccinated, and we'll be watching that science very carefully. As I said, it's an area that is still uncertain for many researchers, but we've asked NACI and others to look at the question more closely, and we'll come back to those travelers very soon.
Yes, and as a follow-up, still for Minister Hajdu, why is Sinovac not considered an adequate vaccine since it's authorized by the WHO?
Well, thank you again for the question. And we've chosen to start with the 4 vaccines authorized by Health Canada because, of course, we know those the best, having our regulators having reviewed all of the data to approve them in Canada. We are contemplating how we will expand that list, including using the WHO-approved list. But for now, we're starting with the Health Canada-approved vaccines, and we'll continue to assess those next steps as we move forward.
Thank you, Minister Hajdu. Merci beaucoup. Donc, voilà qui met fin à cette conférence de presse.
This concludes our press conference.
Merci. Thank you. Bonne journée. Have a wonderful day.
Merci. Thank you. The conference has now ended. Please disconnect your lines at